Heather Walters says the Oregon health plan saved her husband's life.
He desperately needed help, and without OHP, he would have definitely been homeless or potentially dead.
As a freelance writer and mother, Heather didn't have insurance, and Thomas was too sick to work, struggling with bipolar disorder. OHP helped pay for his emergency care, but she says finding a therapist under the plan was nearly impossible.
The only reason my husband is okay now is because his parents helped us with their money. They paid out of pocket for him to be able to get to a psychiatrist, to get medication and get treatment.
Take your fingers out of your mouth.
Thomas's father and co-owner of Core Values Counseling, Eric Walters, said they had no choice but to shell out about $15,000.
It was difficult, but it was like, we're going to do this, because he's our son.
As of October 1st, Medicaid insurer Care Oregon will no longer pay for Oregon Health Plan clients to see non-contracted providers. Core Values Clinical Director Sabrina Walters says many people don't have the resources her son had as they struggle to find in-network providers.
The last thing we want to do is let all of these clients go and make them try to find someone in network, which is going to be very difficult because there's 15,000 people now going to be looking for therapists. I don't even know if it's legal what they're doing. It feels to me like they are keeping people from getting the care that they need.
Thanks to his parents, Thomas got the help he needed. He and Heather grew their family, and he found a job as a pastor. But this family worries about others.
Do they have to have a job in order to have health care? That mentality is basically like, if you're not working, you don't deserve to live.
Care Oregon says changes are needed to cut costs after Congress passed Medicaid cuts through the president's big, beautiful bill. Walters say they have 10 therapists they notified yesterday about the upcoming cuts. Core Values has asked the Oregon Health Plan to approve them as in-network providers, but don't know if that will happen by the October deadline. David, Christine.